go get your coffee and join me on GHC Coffee Break today. We're going to talk about taking care of your dog, and we've got some special guests. Get your coffee. We'll be right back.
That meet my educational and career goals.
With opportunities outside of the classroom,
where the faculty know me by name.
My college can prepare me for my career.
I can earn an associate's degree and transfer credits to a bachelor's.
My college is a state college within the university system of Georgia.
My college offers courses that fit my schedule.
It's where excellence begins.
We are.
We are.
We are.
We are GHC, Georgia Highlands College.
Hey, welcome to GHC Coffee Break. I'm glad you could join me this morning with Dr. Carr and my special guest, Lakota. Lakota is an Australian Shepherd. Dr. Carr is not. Dr. Carr is a local veterinarian, and he's coming to talk to us about September, which is Take Care of Your Dog Month. Okay. And we have our guest today with us, Lakota. We'll see how good he stays. It's a little excited. And we were talking, Dr. Carr, I believe that Australian Shepherds like to be very active.
They're high-octane dogs. They really are. Yeah.
So, well, let's talk a little bit about taking care of your dog and getting. I know there's a lot of things. I worked for a veterinarian for probably about 4 years out of high school, and loved every minute of it. But there's a lot of things that I think today that's changed, even because this was like, okay, I'm telling my age, 30 years ago. So a lot of different diseases and stuff that's out there that we didn't deal with.
Right. I guess, although it's not new, it's probably been around since the early 80s, is parvovirus.
Yep, it was just coming.
And that's always, distemper is such a deadly virus, but we don't see distemper like we used to. It's just not nearly as common. But parvo is real, and it's a puppy virus, and I don't know how many puppies come down with parvo that are not vaccinated, but most of the puppies that we see that come down with it, are not vaccinated. And if they're vaccinated and vaccinated properly, it's a pretty effective protection against this ugly, ugly disease.
Well, let's start with puppies. Okay. When a dog is 6 weeks old, is that when they start getting their shots?
Mm-hmm. Yep. And ideally, and it's not somebody say, well, so many 4 shots, 3 shots, or whatever. But ideally, you start at around 6 weeks, and you vaccinate them every 3 weeks till they're 14, 15, 16 weeks old.
Okay. And the shots that they typically get?
Well, kind of mentioned distemper. We still vaccinate against distemper. That's a biggie, and of course parvo. And then there's a few others. There's hepatitis, and which obviously is a liver virus, and parainfluenza. And then lepto, and some people don't vaccinate against lepto, but lepto is a infectious disease that affects the liver and the kidneys, and it's usually transmitted through wildlife urine. And so, if a dog's around a pond or a creek or any low-lying area, they certainly could be exposed to lepto.
Okay, so that one I wasn't familiar with. Yeah. Distemper, of course, is the one I most.
Yeah.
And then parvo, like I said, was coming on the scene. What exactly is parvo?
Well, it's a virus, and most viruses, once they're in the environment, they're not very stable. They're going to die fairly quickly. But parvo can live for months or sometimes even years, and that's why you can keep your dog at home and not have it exposed to any other dogs and still come down with parvo, because you can carry it home with you and never know it.
And what exactly, it's a virus, what does it do?
Well, it mainly attacks the lining of the intestinal tract.
Okay.
So it's kind of like you go in there with sandpaper and you just scrub the lining of the intestinal tract. So these puppies, they can't eat, they can't drink. If they do, it's usually coming back up. But it also can affect the bone marrow and decrease the white blood cell count, and can cause some heart-related issues too. Okay,
and it usually occurs in puppies?
Usually, yeah. It's rare to see parvo in a dog over a year of age. The virus attacks rapidly dividing cells, and there's a puppy. They're just growing like crazy. So.
And now I know most people have probably heard of distemper, but what exactly does distemper cause?
Distemper affects every organ in the body. But you know, mainly what is fatal with distemper is it affects the brain and causes seizures. And you know, you'll start off with a runny nose, maybe a snotty nose, and a cough, and that kind of gets better. And you think, well, my dog's okay, and then 2 weeks later they start having seizures. And you know, once you get to that point, there's nothing you can do.
Right.
So.
Yeah, I think, and then the after the initial, when they get a year or two older, of course, and the rabies vaccine comes in when?
They have to be, state law, they have to be 3 months old.
3 months old.
And then in Georgia, after they've been vaccinated that first year with a 1 year rabies, then the next time you can do a 3 year rabies.
Okay.
And you know, you're talking about vaccines. We used to, talking about 30 years ago, things have changed a lot for me too, but we used to vaccinate for everything every year, and now as they get older, typically they hit 4 or 5 years of age, there's a lot of things we'll start not doing every year, you know, maybe even every 2 or 3 years. Because there is some proof that vaccines can stimulate the immune system and cause some immune mediated or immune related diseases that we've kind of triggered with vaccines.
Oh, okay.
So.
Yeah, I know I was telling you I have an older dog, and I don't take him in anymore to get those shots because I feel like he's at the age where I want him to live out his life to his fullest, but he's doing great other than he's got some, he's a Boston Terrier and a rescue dog, and probably 13 years old, guessing I've had him for at least 5 or 6 years, and he was at least that old when we got him. And but he's starting to have problems with his hip. We assume arthritis kind of stuff.
Probably is.
They're very active dogs, Boston Terriers are, and probably one of the most easily changed owners. I don't know how loyal they are. It's like they'll love anybody that'll love them.
Well, that's good.
But taking care of an older dog, even, you know, we talk about the younger dogs, but the older dogs, I think they've got it's kind of like older people. Older people, there's a little different care that they need. For us, with him right now, it's TLC, and we have him 2 younger playmates, because it seemed like this sounds awful, we had an old dog and a young dog, and when the old dog died, we were kind of left with the young dog not having a companion, and then we ended up getting a dog that was younger, and it kept the cycle. It was awful. So my heart was being broken way too much. And so now we have 2 about the same age, and then Gizmo, who is the old man of the house, I guess. And what are your recommendations as far as of companions with dogs? Are they better single or?
That's a good question. You know, some of them certainly do much better with a companion. And I don't know, you know, if you're working every day and you're gone for long periods of time, are they better off with a companion? I don't know. I don't know what the right answer is.
So you're not a psychiatrist.
Well, some of them get along great, and sometimes they don't get along so great, you know. So it's kind of sometimes bringing another one in kind of upsets the apple cart just a little bit.
Well, like I said, when you're talking about care for dogs, I look at it more, yes, we want to care for their vaccines, heartworms, of course, we didn't talk about that.
Right.
Let's talk a little bit about that. What's the implications?
I tell you, here in Georgia, I mean, to me, if you know, maybe a totally indoor animal, you're probably gonna, if you don't use heartworm preventative, you're probably going to win more than you're going to lose. But if they're outside in this part of the country and they're not on preventative, they're going to get heartworms. And boy, the treatment is a long, drawn-out process. I mean, most of the dogs do well with it, but it's just so simple to give them a pill once a month, or now there's an injectable that lasts 6 months, and it's just so simple to do. It's just, I mean, even if they're totally indoors, to me, it's not smart to not have them on heartworm preventative.
And what causes heartworms, and what does heartworms do?
Well, it's they're transmitted by mosquitoes. You know, in fact, you know, if you had a dog that had heartworms, and you took blood from that dog and you gave it to another dog, it wouldn't get heartworms. You know, they have to go through the mosquito. And so, you know, here in Georgia, we got plenty of those. And from the time the mosquito bites the dog until the heartworms become adults in the heart is 6 months. And then they cause, you know, inflammation mainly in the right side of the heart, in the pulmonary artery, you know, and of course the lungs too.
And Dr. Carr, I'm very remiss. I introduced Lakota a while ago. I left out my poor intern guest host today, Megan Guys, who was a student at Georgia Highlands. Had my back. I'm not used to having a guest host, and totally got involved in talking about puppies. That I left Megan out.
It's
Megan,
okay.
I do apologize.
It's okay.
It's like the viewers at home are probably going, well, there's a lady over there sitting
Yeah.
that's been totally ignored for the past 10 minutes. But
I'm waiting my turn.
waiting your turn. Megan, do you have pets?
Yes, I have 3 dogs and 3 cats, so.
Oh, okay, so you
A
have
bunch.
both.
Yes.
What kind of dogs do you have?
I have a Great Pyrenees, I have a Shih Tzu, and a Chihuahua.
Okay. Oh,
Yeah.
kind of steering.
Yeah.
You sure do, girl.
Exactly. Stepping stones, but
So the Great Pyrenees doesn't think the Chihuahua is a snack.
no. Well, probably. Yeah, a little bit. But they're usually okay together. So.
And a lot of times Chihuahuas, I have found, think they're the big dog anyway.
Yes.
They do.
And
Most definitely.
much to their detriment at times. And that's another thing about with Carr. We're talking about heartworms. Sorry, I got distracted. It's been one of those mornings, but that's okay. But I know that they're for mosquitoes, and they cause worms in the heart. I think.
Actually in the heart. Mm-hmm.
And then of course I guess that leads to heart failure.
It does.
Okay.
It does.
And I think that's
most of the times when we diagnose heartworms, they haven't gotten to the heart failure part, which is good. So, but if they ever come in, it causes right-sided heart failure, which causes fluid accumulation in the abdomen. They'll be pot-bellied and they're coughing. And when they get to that point, I mean, you can treat the heartworms if you want to, but you know the damage is done. So.
When I was growing up, I mean, I've had animals all my life. That wasn't even, is this something that's new?
Well, you know, we've got better ways. First of all, I think probably heartworms we started knowing about heartworms in the 60s, and then in the 70s it got pretty common, and in the 80s really common. But we didn't have really good ways to detect heartworms until probably in the 90s when we started having some of these antigen tests that we run. So before that, you were looking for microfilaria, which are the baby heartworms, and there's a fairly, I don't know what the percentage is, but you can have adults in the heart without having the microfilaria, which are the babies in the bloodstream. So it could be, you could miss some of those, but now it's pretty easy to diagnose.
And then, of course, before we go to break, we'll talk a little bit about other kind of worms that seem to be very common with just about any kind of dog. Tapeworm.
Tapeworm and tapeworms usually can be controlled really well if you just keep the flea population under control. And
yes.
It's also, I tell people all the time, although it's an ugly worm, because people see these look like a grain of rice in their dog's stool, and they just freak out.
That's when they dry up, when they're fresh.
Yeah, they can. But yet, if you had to pick a worm for your dog to have, it's a fairly harmless worm. Hookworms and whipworms you can't see; they really do a whole lot more damage to the lining of the intestinal tract.
So both of those are specifically to the intestinal tract.
Yep.
And
Yep.
cause now. Can any of these worms, because I know a lot of pet or potential pet owners, especially when babies come in, can any of these worms be transmitted to people?
Well, not very commonly, but it's possible. Okay. I mean, it is possible. So, you know, anytime you get through, you know, petting your dog or your cat or whatever, certainly, you know, washing your hands is a smart thing to do. You know.
Yeah, because when we're dealing with
but
pets,
it's rare.
Okay, like I said, you know, potential pet owners and I've heard many times when you have a baby, oh, you're going to keep that dog around the baby.
Right.
So I want to dispel some myths because we do, pets and people are good for each other, I think. I think pets need people and people need pets.
I agree.
That's my opinion.
I agree.
I think that's a companionable. I mean, why did we? And that, maybe we'll talk about that when we come back from the break. Go get your coffee. We're going to talk about why pets and people are good together. Get your break. Get your coffee. We'll be right back.
The average text takes your eyes off the road for nearly 5 seconds.
Welcome back to GHC Coffee Break. Hopefully you had a chance to get your coffee. Talking about a couple of disgusting things with worms, but it is an important part of care for your pet. And like you said, the tapeworm is probably the one that most people are very familiar with. Like you said, because you do see it. It's like, oh, that's a worm. But I said when we left for break, and we do have a couple other things I want to talk about with care. But the idea of pets and people together, you know, I guess historically we've seen that whether it's dogs or cats, I guess some people are both cats and dogs. We have both at my house as well. But that need of companionship. I know that there's the compassionate paws and different things because they've proved that animals can be very therapeutic to people. So,
no doubt about that. Yeah.
So, all right, big thing. Let's talk about spaying and neutering.
Okay. Well, you know, as far as spaying either, you know, kitty cats or dogs, either one, and it's certainly the reason that every female dog I ever get is spayed. It eliminates the likelihood of breast cancer when they get older. That's the big thing. And if you don't spay your dog, probably at 8, 9, 10, 11, you know, there's a good possibility that they're going to develop breast tumors. Now, a lot of these breast tumors are benign. You know, they're not going to cause any trouble, but the bad ones are bad ones. You know, and if you spay them, ideally before their first heat, you just pretty much eliminate that possibility.
And that's a new one on me. I did not know that there was a correlation with breast cancer of any kind with animals. Really, I mean, dogs.
Yeah, that's the big. You know, of course, you eliminate the 2 to 3 weeks of heat that you've got to go through with your dog. You know.
True.
And of course, when they get older, they can develop a uterine infection that only can be solved by spaying them. And then you've got an older sick dog, so that's not an ideal situation. But the breast cancer is the biggie, I think.
Okay. You know, again, there's a lot of things that animals that are common to humans, like breast cancer. I don't think humans can get heartworms, but you know, there's a lot.
Well, I mean, every once in a while, they can develop a lesion in their lungs that, you know, because we're not the number one host. The heartworms don't do in us what they do in dogs, but we can actually have some lung lesions from heartworms. It's not very common.
Yeah. Hey, something to know. Other things but back to the spaying and neutering.
Yeah.
Of course, the overpopulation.
Oh, yeah.
Obviously, and there's a lot of. I see more feral cats than I do dogs typically, for some reason. But that.
Well, they just can multiply like crazy. That's the big thing.
Yeah, they do go into heat more often than dogs do.
They do.
But population control, neutering, is there something?
Yeah, you know, I mean, certainly with you know, castration and dogs, and of course.
Yeah, that's a pleasure of having a guest that likes.
I'm gonna let you know something's going on out there. Yeah.
Wants his voice heard too. But Lakota. Hey.
But a kitty cat, a male cat, you know, they're going to get out and they're going to fight and they're going to get in all kinds of trouble. So, you know, neuter them certainly stops that from happening, or at least eliminates a lot of it. And with male dogs, prostate issues when they get older, pretty common.
You've been so good.
as well as the marketing and all that goes along with, male dogs. So.
You must have saw something because you were being so good. What did you see? Yeah. Well, and that's the other aspect of having a pet. When something comes around that's not supposed to be there, he was like, everything was good. If something walked by at the studio, good dog. Yes, good Lakota, letting us know that wasn't not right. But having a guard dog.
You bet.
With the neutering on males, is there a behavioral benefit?
Sometimes if you've got an aggressive or dominant dog, it may help. But people want to neuter their male dogs so they can stay at home. It's not going to matter. If they love to get out and roam and explore, you neuter them, they're going to get out and roam and explore. It's not going to stop that. But certainly, some aggression or dominance type things, it can help there.
Okay, because I know with Gizmo, like I said, it was an adopted or rescue situation, but we have a fenced-in yard, and he got really creative of finding
a way to
if
get
there
out.
was any way possible, he could find it. Sometimes I thought he was Houdini. Now that he's older, he don't even try. But we would find, we have to patch up this part of the fence or that part of the fence. So it probably wouldn't have helped to get him neutered anyway.
Probably not. Now certainly if there's a female in heat in the neighborhood or something, they're gonna go crazy trying to get out. But generally, dogs just like to get out and go.
If they're roamers, we've got a really big yard. I mean, that's the good thing. And even in his old age, he likes to get out there and run. And that's the other thing of again, I guess I keep looking at the aging because my dog is aging, and I've got two that are probably 5 years old, and he's the old man, but the activity level of him, what is your opinion on working with older dogs that you just kind of let them have as happy a life as you can?
Sure you do, but exercise, just like for us as we get older too, it's important. So that daily exercise or that daily routine or that daily walk or whatever is a very good thing, but yet you don't want to push them. They
let
need
them do what they want to,
exactly,
as they want to.
Yeah.
Now we talked about Lakota being an Australian Shepherd, being a more active dog. That's something else. If you were choosing a dog today, what kind of things can you give our audience an idea of what should they be looking for?
Well, people ask me all the time, what's the perfect breed? And there's not. And it's kind of, it too is what do you want? Like I have pointers, and somebody else would see these crazy bird dogs that run like the wind and just they're hyper, and they'd say, man, I don't want one of those. Right. Well, that's what I like, So it's really hard to say, boy, this is the breed that you need to have. I really, it's hard to say that.
Well, I guess I watch a lot of Animal Planet, so like Puppies 101. But looking at what your lifestyle is,
right? Well, there certainly are some very high maintenance dogs. English bulldogs, I love them, but good night. I mean, they have breathing issues, they have skin issues. I mean, there's a lot of problems with them, and of course, having I guess a short-haired dog makes it a little easier as far as maintenance goes, but probably not that big a deal.
So kind of based on your lifestyle, if you've got an Australian Shepherd or
you need to be able to get them out and let them chase the frisbee or run, or because they're going to do something. If you keep them cooped up in the house, they're going to chew the furniture or something. They just got to be doing something, And when you look at what they were bred to do, I mean, they're out there herding cattle or sheep or whatever. I mean, they're just they gotta be busy.
And I think Animal Planet is a good source of looking animals. Our Puppies 101 and Cats 101. You know, Megan, you said you had the Great Pyrenees. You know, what kind of things do you have to?
We have to play with her all the time, because if not, she will tear everything up. She digs holes.
And they're big. If you don't know, audience, they're really big dogs.
Yeah, she's huge, so she can destroy anything in about 5 minutes. So we definitely have to, we play Frisbee with her. We definitely have to go through toys consistently, but we just try and make sure that she's running and getting most of her energy out most of the time. Cause
now, compared to the Chihuahua,
who doesn't do anything.
Oh, really? Okay.
He's so lazy. He just kind of lays on you, and that's all he wants to do.
Is he older or younger?
No, he's kind of in between, I guess. But he's just a lap dog, so he just doesn't want to do anything else except for lay there and bark at you.
Now, what about the Shih Tzu?
He's kind of in between. He'll play with you, but he doesn't get as hyper as the Great Pyrenees does, because she just wants to be running around all the time, and he just kind of goes back and forth. So depends on the day.
Is there something you would like to ask Dr. Carr as a pet owner?
I don't know. Not really.
Yeah, it's one of those things. Again, I think the individual. I do have an outdoor cat that will not stay inside, but especially since we got the Boston Terriers, because they don't like each other at all. And it's quite challenging. And I don't like having, I like my animals inside. I like to be near them. I like my cat to be in. She had a cat door she could go in and out, but when we introduced the dogs, it was not a good match. And she was kind of particular anyway, but she's a bobtail. I call her itty bitty because literally she looks like a kitten still, and she's 7 years old. And but she's very snooty. She comes when she wants to. She comes when you feed her. She will sit in your lap when she wants to outside. But animals in general, I think, are very unique to our personalities, and I think that's one of the things that we have to be attuned to. And anything else, you want to remind us of pet care, dog care for this month?
Well, you know, the biggest thing is that where we see trouble is where animals roam. You know, I mean, we see the hit by cars, the shot, and not always poisoned maliciously, just getting into something that, you know, they wouldn't be able to get into if they weren't confined. So, you know, keeping them in a fenced-in area in the house is just, it's just such a, you know, important thing to do.
And with my dogs, I'm very persnickety. Unfortunately, with my cat, she is a roamer. But
well, yeah, kitty cats are a little bit different story. You know, if they go out, it's kind of hard to confine them. There's not a fence they can't climb hardly. You know, so.
Or a tree that they can't climb, but can't always get down.
Yeah, well, that's true.
That blows my mind.
That's true.
So, well, our time is about up. So I do want to thank you, Dr. Carr, for joining us, talking about dog care, but pet care in general. Megan, thank you for joining us. Sorry, I did not sit right because of the puppy. I had my back to you most of the time. I apologize. But until next time, get your coffee, and we'll be right back.
College offers classes that meet my educational and career goals,
with opportunities outside the classroom,
where the faculty know me by name.
My college can prepare me for my career.
I can earn an associate's degree and transfer credits toward my bachelor's.
My college is a state college within the university system of Georgia.
My college is affordable.
it's close to home.
My college has online opportunities.
It's where excellence begins.
We are
GHC, Georgia Highlands College.
Thank you for joining us today on GHC Coffee Break. I've enjoyed having my guest, Lakota, who's actually been very good, except for a couple times with distractions, but that's okay. That's a good thing. And Dr. Carr, of course, thank you very much for joining us and taking care of our dogs. Megan, thank you. And until next time, we'll see you on GHC Coffee Break. Get your coffee.